Hello, my name is Ariel Rayleigh, and for anatomy class, we were required to make a movement analysis video. So in this video, I'm going to be demonstrating folding and unfolding this pair of glasses right here. And I'm also going to explain the osteokinematic movements that are required to unfold and unfold these glasses, along with talking about the upper extremity muscles that are used and the contraction type from each movement. And also, I'm going to be talking about and giving an example of a disease or impairment that could prevent somebody from folding or unfolding glasses. So I wanted to start off by talking a little bit about Kienbach's disease. So Kienbach's disease is a condition in which the lunate bone in the wrist starts to break down due to the lack of blood flow and supply. And this condition can cause pain, swelling, stiffness, and weakness to the wrists and hands. An individual who is at risk for developing this condition can include having previous trauma and repetitive motions of the wrist. And these symptoms can lead towards difficulties in overall wrist mobility and grip strength. So therefore, this condition may prevent one's ability to fold and unfold glasses effectively just due to needing consistent wrist and hand stability, mobility, and grip strength. So I started off with the shoulder girdle section, and in this section, much like the other ones that I'm going to be discussing in this video, I started with the osteokinematic movements, the upper extremity muscles used, and then lastly, the contraction type. So my first osteokinematic movement was protraction, and the upper extremity muscles used was the serratus anterior along with the pectoralis minor, and the contraction type was concentric. Next, I used the osteokinematic movement of retraction, and alongside this, the upper extremity muscles used included the trapezius, which was all three portions, alongside with the rhomboids. And this contraction type was also concentric. Next, I used upward rotation, and alongside this, the upper extremity muscles used included the trapezius again, which was all three portions, alongside with the serratus anterior of the lower fibers. And this contraction type was also concentric. Next, I used downward rotation as my movement. Alongside this, the upper extremity muscles used included the rhomboids, levator scapula, and the pectoralis minor, and the contraction type for this was concentric. Next, I used elevation, and alongside this, the upper extremity muscles used included the upper and middle trapezius, the levator scapula, and the rhomboids, and that was also a concentric contraction type. Lastly, I did depression, and this involved the lower trapezius and the pectoralis minor upper extremity muscles. And lastly, this was a concentric contraction. So for this next section, I'm going to be talking about the shoulder joint. To start off, for the osteokinematic movements, I had medial or internal rotation. Alongside this, the upper extremity muscles used included the latimus dorsi, the teres major, the subscapularis, the pectoralis major, and the anterior deltoid. Alongside this, I also did the contraction type of concentric. Next, I talked about lateral or external rotation, and the upper extremity muscles used included the infraspinatus, teres minor, and the posterior deltoid. Alongside this was also the contraction type of concentric. Next, I talked about flexion, and alongside this was the upper extremity muscles that included the anterior deltoid, the coracobrachialis, the pectoralis major, which was in the clavicular section. And alongside this was the contraction type of concentric. Lastly, I talked about extension, and alongside this was the upper extremity muscles of the posterior deltoid, the latimus dorsi, teres major, pectoralis major, but instead this was the sternal section. And lastly, I talked about the contraction type, which was concentric. Within this next section, I wanted to include two different perspectives within the video that really showed both the elbow and forearm together. So to start off, the osteokinematic movements I included was elbow flexion, and the upper extremity muscles that were used included the biceps brachii, the brachialis, and the brachioradialis. And next, the contraction type was concentric. And then I did elbow extension, and alongside this, the upper extremity muscles used included the triceps brachii along with the anconeus, and the contraction type for this was concentric. Next, I included forearm pronation, which included the upper extremity muscles of the pronator teres and the pronator quadratus, and this contraction type was concentric. Lastly, I did forearm supination, and with that, the biceps brachii and the supinator were both upper extremity muscles used, and lastly, the contraction type was concentric. So next, I wanted to go over the wrist section. And to start, the osteokinematic movements included wrist flexion. And the upper extremity muscles used within wrist flexion was the flexor carpi radialis, the flexor carpi ulnaris, and the palmaris longus. And with this, the contraction type was concentric. Next, I did wrist extension, and with this, the upper extremity muscles used included the extensor carpi radialis longus and brevis, and also the extensor carpi ulnaris, and the contraction type was also concentric. Next, I did radial deviation, and the upper extremity muscles used included the flexor carpi radialis, the extensor carpi radialis longus as well. Also, the contraction type was concentric. And lastly, I did ulnar deviation, and with this, the upper extremity muscles used included the flexor carpi ulnaris and the extensor carpi ulnaris, and this was also the contraction type of concentric. And for this last section and video, I wanted to go over the hand. So to start off, the osteokinematic movement included flexion, which had the upper extremity muscles of the flexor digitorum superficialis, the flexor digitorum profundus, and the flexor pollicis longus and brevis. And with this, I included the contraction type of both concentric and isometric. And with this, basically I started at concentric and went into isometric. As isometric, I basically continued to grip the glasses with my fingers and move throughout the video. And next, I included extension, and with this, the upper extremity muscles used included the extensor digitorum, the extensor pollicis brevis and longus, the extensor indicis, and the extensor digiti minimi. And with this, the contraction type was concentric.